Hi, I'm Dr. Clayton Stitzel here with Addie Mister for her blog Curved and Twisted, and she asked me to do a little talk on scoliosis as a multifactorial condition, meaning it has both genetic and environmental influences that cause the condition to be expressed. So, this is Addie. Right. So, what we got going on here is, like all conditions that are non-congenital, meaning they're acquired, there's a genetic predisposition for the condition as well as there are environmental influences that cause that genetic predisposition to be expressed. A classic example would be something like lung cancer. So if you have a genetic predisposition for lung cancer and you smoke, odds are you'll probably get lung cancer. If you don't have a genetic predisposition and you smoke, you won't get lung cancer. If you have genetic predisposition and you don't smoke, you probably won't get lung cancer. Okay? So this is what we're seeing here. So scoliosis appears to be along the same lines. We know that there is a family history, otherwise known as a genetic predisposition, for the condition. Okay? We also know that there are certain environmental impacts that seem to make the condition become more expressed genetically than not. What we have is we have a basic algebraic problem here that really creates an unsolvable situation. We know we have x and we have y, and we have that equaling scoliosis. Okay? You can't solve an equation with two unknown variables, right? So what we need to do is we need to be able to start identifying the kids who are most at risk for genetic predisposition for severe progression. So the Scoliosis score test has done a lot of work in that regard. Okay? And once we know those kids on their genetic predisposition, whether it being high, low, mediate, intermediate, whatever, okay, then we can start controlling for the environmental factors in those particular cases and see which controls really have an impact on those kids who are genetically predisposed to having severe curvature. So this is a key component here, and you're not going to be able to solve the equation until we can start identifying and eliminating one of the variables, because again, with two variables. So environmentally here, we're not able to identify the specific environmental influences that seem to be causing the genetic predisposition to be expressed because we don't have a way of identifying the genetics of the kids on a large scale. Now again, the Scoliosis score test is working on this, but there's not many kids being tested, so we don't have that, and there's no central database. So what we have going on is it looks like the environmental problems fall into three categories. And again, this is still very early, but it looks like we're running into biochemical, we're looking into biomechanical, and then we're looking into activity-related things. Things are in activity-related, like we're seeing correlations with patients who repeatedly hyperextend the mid-back, like in gymnastics or swimming or those type of things, okay? Those tend to have a higher rate of thoracic curve progression than patients who don't engage in those things, okay? Biochemistry, we're working on neurotransmitter stuff. We're looking at the melatonin, the serotonin to melatonin conversion pathway. Seems to have a significant implication in scoliosis and through progression. And biomechanical, we know that there's a certain amount of, at the end of the day, the physics end up controlling the situation to a large degree. And we need to identify and minimize those biomechanical stresses that also lead to progression. So when we talk about scoliosis here, we need to start talking about it in terms of not just a curvature, but also the genetic and environmental influences that lead to the condition itself. Okay? If you want to influence this, we're going to have to work these sides of the equation. And as of now, genetic therapy probably isn't going to allow us to change our genes. Okay? So what we need to do is we need to start really focusing on identifying the kids who are genetically at risk, studying them to start learning more about the environmental influences that can cause progression of the curvature. And once we do that, we can start using that to minimize and manipulate the environment so that we're now working on a preventative measure rather than a reactive measure. That's the future, guys.